Greetings, I'm Dr. Peter Slavin, and it is my pleasure to welcome you to this special video and to highlight that every one of us shapes the Mass General patient experience every day. Regardless of your role, whether you help patients and family members through direct patient care, whether you support our caregivers, whether you're conducting research, or even when you walk through the halls of the hospital, you represent Mass General. Patients and families are why we are here, and I care deeply about reinforcing this and introducing iCare. iCare is a model developed to highlight the expectation that we strive always for excellence in our interactions with patients and families and with each other. iCare stands for communicate, advocate, respect, and empathize. We aim to deliver iCare consistently and positively and to exceed expectations. In this video, you will hear from members of our patient and family advisory councils who do wonderful work collaborating with us, and you will also hear from some of your colleagues. iCare will help advance the Mass General mission, which states, "We are guided by the needs of our patients and their families as we aim to deliver the very best health care in a safe and compassionate environment."
The reason why I come here is because I feel so many times a wonderful feeling as you come in the door. It's a warmth. I see that everyone here is treated so very well that it warms my heart.
When you come here, we give you that welcome feeling, that feeling of comfort that you are in the care of the best hands.
I think of communication as the base, and it's the quality that's necessary to be able to convey all of the other care that we deliver. And it's the quality that's necessary to be able to convey all of the other parts of the iCare model.
So I'm going to be with you from 7 a.m. to 7 p.m. and I'll be your nurse all day.
Every morning when I come in and I go in to meet a patient, I introduce myself with my full name because I think it's nice for patients to know who's going to be taking care of them. There's often many people going in and out, whether it's a PCA, nurses, doctors, social workers, occupational therapists.
If you walk in and say, "My name is Dr. So-and-so," then you immediately set the stage for the other people in the room. So I think the modeling aspect of it is extremely important.
And it comes down to talking clearly with people, explaining well what's going on. These are very complicated topics that we're trying to help people with no medical background understand.
They tell me what they're giving me, so they have that professional side, but it's also nice to be able to sort of laugh and chat and talk about what they're doing out in the world when you're stuck in the hospital. So it's a really nice balance.
When you smile to anybody, it opens up a door for them to speak to you, to relate to you, to want to be around you, feel that comfort. Hi guys, morning. How are you doing? So I always tell them, break that ice by smiling and saying, "Hi, you're here for care, and we're here to take care of you."
It's hard to put any sort of value on the smile, but the value is very high. I mean, it really makes a big difference, I think.
The fact that you, as a caregiver, no matter what your role is, are making eye contact, they understand that you're listening and that their opinion is valued.
They listen to what I have to say. Very often they'll repeat back and using their own words to make sure that we're in sync. And they reach out to make sure that I, as a patient, am comfortable.
Safe, I think that's the word that I feel safe, that I'm listened to.
We espouse advocacy. What we're doing is really charging all of our employees with stepping forward and saying it doesn't matter where the patient is, and it doesn't really matter what the patient needs. It's my job to step forward and to connect patients with the needs that they may have at that moment.
My infectious disease doctor had me sit in his office while he calls different specialists and has a conversation in front of me to make sure that the follow-up happens the way that it needs to, and so it's really coordinated when it needs to be.
Every day during medical rounds, I try and speak up on behalf of my patient, but most importantly, advocate for them and their well-being, and I also try and relay this information back to the patient and or their family member, just to keep them in the loop as far as communication and goals for the day.
And the force of the team that is surrounding you, if you will, gives you a great feeling of reassurance and comfort that you're being cared for well.
We all enjoy helping people, and I think we get some gratitude at the end of the day when we know we spent a hard day's work truly helping somebody either get better or, you know, in some unfortunate cases, die with dignity.
I think it shows a culture and not just a technique.
In fact, coming up here, the ambassador standing out there, I said, I've not been here before, can you tell me where the healing garden is? And he pointed the way, and he started coming down with me a little bit to make sure I was going in the right direction. So that's an example of somebody, I think, going out of their way.
We can't convey how much we care, and we can't convey important information like that's necessary to convey during a medical appointment if we don't start with that basis of respect. And every interaction counts. Respect is something that we not only have to show patients, but we have to model and show each other.
I'd say that the culture here is very warm and helpful and treats people like people, and not just as cases.
It's a good feeling to know that you're not just a number, and they know you individually and remember your story and want to be part of your future.
And I guess that's the big thing, is I don't feel alone with my care. I know I can talk to these experts, because I'm an expert on my body, but I'm not expert on medicine or the treatments.
Things are busy nowadays, and taking those few moments to just establish a nice relationship and to demonstrate respect to your patients and their family.
I guess, by dealing with them as a human being, regardless of their face and regardless of their colors or the differences of thought or anything.
And I don't feel so much like I'm a, quote, patient. I just feel like I'm being treated as a person.
I think it's really valuable for trainees to spend some time with the folks who work at the front desk, who work scheduling patients, who understand what the day-to-day trials and tribulations of receiving health care are like. That really helps to reinforce that message of empathy.
I think that whole team effort and the team effort at empathy really makes the experience so much better for the patient. And I think that's something that our team is learning and remembering now.
I've never had doctors say that to me before, that they're sorry that I have to go through this because it's sort of outside the regular relationship, and it really made me, I don't know, it really turned things around, not just in that day, but with the rest of my care, because then it's sort of like, okay, you can do this.
And I see that empathy given from the doctors on staff to the young people that are beginning to work here and are learning by example. So that's fantastic.
The nurses were wonderful with giving us information, giving us a hug if we needed a hug, give us time to be alone with her. They were definitely empathetic, and it was definitely helpful in her, at the end of life care.
I'm a strong believer in lifelong learning, and I think that's one of the things that we all need to pay attention to, is to have more empathy, to have more understanding of the people that, we're around. We're all different and you need it.
Just put yourself in their shoes, and if you were going through what they're going through, how would you want to be treated? You would want somebody to care for you, and you may not be in a strong state of mind, so every little bit helps at that point.
Hi, I'm Debbie Burke, Senior Vice President for Patient Care and Chief Nurse. The voices of our patients and family members, such as those you've heard, remind us of why we chose to work in healthcare and why we come to work every day. When people are feeling vulnerable and scared and out of their familiar environment, it's the small acts of kindness that make the difference. You could be the person whom patients and family members are recalling days, weeks, months, years from now, as the one who made the difference during the difficult time. You can make that lasting impression. Thank you for caring.
Hi, I'm Tim Ferriss. Thank you for joining us to watch this important video. As Dr. Slavin said, iCare will help advance the mission that we are guided by the needs of our patients and their families, as we aim to deliver the very best healthcare in a safe, compassionate environment. Thank you again for your valuable time watching this iCare video.